Welcome once again to my channel, and today we are going to look at another antihypertensive drug, and then we'll focus our lens on the ACE inhibitor, that is the angiotensin converting enzyme inhibitor. Let's look at the mechanism of action of the angiotensin converting enzyme inhibitors. Alright, so this drug inhibits the activity of the angiotensin converting enzyme, which is an important component of the renin-angiotensin-aldosterone system, that's the RAS, which converts angiotensin 1 to angiotensin 2. That's a potent vasoconstrictor, and also increase the level of bradykinin. Good. So for you to appreciate the mechanism of action of this drug, you can review my previous presentation on the RAS. It will give you insight and help you appreciate more of the mechanism of action of this drug. But in the next slide from here, there's going to be a little bit presentation on this mechanism of action to enable you appreciate this mechanism of action of the drug itself. So let's look at the pharmacology effect. We are focusing on hypertension. So this drug decreases blood pressure. How does it do that? By the relaxation of the blood vessels and decrease in blood volume and, and oxygen demand of the heart. Decrease in blood volume and oxygen demand of the heart. The side effects include dry cough, angioedema, and hyperkalemia. The dry cough and angioedema is as a result of the increased level of bradykinin. The angioedema will be noted or seen when there is an increased level of bradykinin, evidenced by swelling of the lips, tongue, and sometimes the larynx, which is very risky and dangerous at that point. The hyperkalemia is as a result of the cutting off the process of the RAS, meaning aldosterone is not released. Therefore, elimination of potassium is not done. So there will be retention of potassium. So that will be an increased level of potassium in blood. That is hyperkalemia. Alright, so we have a diagram here which is going to guide us with the mechanism of action. So we have the renin, which is from the kidney as usual. Then we have the angiotensin, which is from the liver. So there is a reaction between the renin and then the angiotensin to give you angiotensin 1, which is not potent enough to perform the role of vasoconstriction, as well as leading on to a point where the adrenal cortex is stimulated to release aldosterone for absorption of water and sodium into circulation to increase blood volume as well as blood pressure. So this angiotensin 1 needs to be converted to 2, which is the active and potent form. But this drug aims at the ACE, angiotensin converting enzyme, which is released from the lungs. So it just blocks the process from this start. So once the process is blocked from this portion, there will not be angiotensin 2, and then there will not be any vasoconstriction to increase blood pressure. There will not be any stimulation of the adrenal cortex to release aldosterone to allow reabsorption of water and sodium to increase blood volume. So at this point in time, we are maintaining a decreased level of blood pressure because there is vasodilation, which is the increase of the bradykinin. The influence of the drug on bradykinin is to increase it, and then helps in vasodilation, so there is more reduction of pressure and as well as the heart rate. And then there's no release of aldosterone to cause blood volume to increase and increase blood pressure. So this drug cuts off the process from this point, decreasing the effect of the potent angiotensin 2. So we have other uses of the angiotensin converting enzyme, which include hypertension, our main focus. Then we have heart failure. Then we have diabetic nephropathy. Example of this drug usually end with pro. So we have lisinopril, captopril, fosinopril, peridopril, ramipril. So they usually end with pro. Thank you for your time, and then we are done with this aspect or this class of antihypertensive drugs. Next time we continue with the rest of the class.